Alright everyone, let's talk about an interesting case which comes often in real life and in any OSCE exam, which is excessive sweating. Basically, that is hyperhidrosis here. As we do every time, we'll look at every case in three angles. First angle, we'll look at how a real patient can present with that problem: primary excessive sweating or primary hyperhidrosis. Primary means there is no cause behind that, because secondary will be happening because of something behind that. For example, hyperthyroidism, when it causes sweating, that is secondary cause of sweating. Okay, again, pregnancy, menopause, TB, but now we are talking about primary hyperhidrosis, which happens for no reason. It is quite often. Second angle, we'll look at what is written in NICE guidelines, so you feel confident when you discuss your information. And the third angle, I will share with you my mind map, single piece of mind map, which covers all in one. So let's start at a possible story. So that will be usually a young lady coming with excessive sweating. Why young lady? Because usually primary excessive sweating or primary hyperhidrosis, it's common to happen before the age of 25. So she may be 18, 19 or so. Okay, and she will be complaining of excessive sweating in her armpits, in her groin, in her feet, in her palms for quite some time, at least more than 6 months. Why? Because the second criteria for primary hyperhidrosis, that it usually happens in less than 25 years of age and more than 6 months of symptoms. Again, she may be complaining that it does smell. Otherwise, she is fit and healthy. That's why it is likely to be primary, not secondary to something she has. And when you ask about relevant maftosa, she may have some family history of the same, because it tends to run in families. So hyperhidrosis is quite common. Usually 1 in 3 of 100 would have hyperhidrosis at some point of their life, and up to 50% of situations it is familiar or runs in the family. When you examine, there will be no problem in examination. That's why we think it is primary. You will offer investigations to look for possible causes to rule out secondary causes of hyperhidrosis. That can, for example, be blood sugar, to make sure it is not hypoglycemia, because hypoglycemia causes sweating. That can include thyroid function test to make sure it is not hyperthyroidism, and everything will be normal in that, or you will just offer that based on your assessment. The patient may have some questions. For example, what is the cause of that? Will I always have the same, or will it ever get better? And what can I do to help with that? Easy peasy. That is typical story of how it comes in real life. So let's go to see what is written in the guidelines. That is the mind map, including everything you need to know. But before we make it 12 out of 12, we'll look at what is written in the guidelines first, starting with the introduction of primary hyperhidrosis. It is quite common, and the primary means it has no apparent cause. You can call it primary idiopathic, primary localized, or focal hyperhidrosis. It mostly affects the axilla, the armpit, the same as our patient. It can affect the palms, soles, feet, face, scalp, and the groin, the same as our patient. The cause is unknown, but up to 50% of the cases can have some positive family history, suggesting a genetic association. That is how you answer her question: doctor, what is the cause of that? It is quite unknown. Most of the time we do not have a specific cause for that, but it tends to run in the families. Up to 50% of the situations, people would have some one in the family has similar problem. So that is how you can answer that confidently. She will ask you, will I always have the same? Will it last forever? Then you can say, I'm afraid it is a long-term condition, but some people experience an improvement with time, and the treatments available can often help keep the problem under control. That is how efficient you can answer that question. From NICE CKS, what is the management in a nutshell? Easy peasy. The management is basically two-sided. Things the patient can do, things you can offer as a doctor. Things she can do, you can advise her to avoid the possible triggers. Okay, you can advise her about the self-care management, like anti-sweating agents, and then you as a doctor can offer her topical strong anti-sweating sprays, such as topical aluminum preparation that can be used as a spray, and I will tell you how to use it. And then you can of course arrange for her a referral if she does not get better by 6 weeks of using the strong sprays and using her lifestyle changes, or what she can do. If we fail to control by these first steps, we then refer to dermatology for advanced treatment such as tablets or injections or even surgery to remove the sweat glands. Easy peasy. The information is quite clear in the guidelines. Let's read again from NICE CKS. Why do we think that is primary hyperhidrosis? Because you need to suspect a diagnosis of primary hyperhidrosis if the patient has the following criteria. First one, it should happen in at least one of the common sites. For example, our patient had it in the axilla or palms or soles, so that's why that criteria is met. The second criteria is that it should last more than 6 months at least. It's a long-term problem. We have read that together already. It should have no apparent cause. That's why we call it primary. Because if it is secondary to hyperthyroidism or to pregnancy or menopause, it will be secondary. And then it should have at least 2 of the following characteristics. For example, it is commonly to be bilateral and symmetry. It usually affects the patient daily activity. That's why psychosocial is an important question in the mind map, and usually it happens at least once per week. Usually it starts before the age of 25. That's why she was a young lady, and the positive family history is usually there, and usually it stops during sleeping. These are the suggestive criteria for primary hyperhidrosis. However, as a clinician, even if it doesn't fit that criteria religiously, you can still suspect a primary based on your clinical judgment. So if symptoms have lasted, for example, less than 6 months, or for example, if the patient is older than 25, you can still think of primary hyperhidrosis based on your clinical judgment. So as you can see, these informations are quite important because that will be our history taking. In the mind map, I will show you how to include that amazingly in the history taking part. And then when you take history, that particular case, you can make it 100% clear by following the presenting complaint very well. She is coming with excessive sweating. If you ask Udibara of that presenting complaint efficiently, you are getting a 12 out of 12. Why? Because Udibara will confirm the primary type of hyperhidrosis. For example, location, where exactly you sweat most. Is it symmetrical both sides or not? How often does it happen? How long does it last for? When did you start experiencing excessive sweating? And then that is the primary symptom, that is the presenting complaint. We ask an open question and then we explore Odibara. So make sure to ask Odibara quite well what time of the day you experience the sweating most. Okay, does it affect your sleep or not? We'll talk about that in details in the mind map, but look carefully. That is how it is written in NICE CKS. And then second step, we ask about triggers, the same as we do in every single mind map. Was that triggered by anything at all? Why? An anxiety can trigger excessive sweating. Stress, heat, smoking, alcohol, coffee, chocolate, spicy food. That's why trigger is always an important question. And then your management, the first line of management is what? Avoiding what was triggering the problem. And then you can ask about associated symptoms. With that, do you have any other symptoms at all? Because as we know, we have some differentials to rule out. For example, if it is associated with hyperthyroidism symptoms, that can be the cause. If it's associated with, for example, hypoglycemia, that can be the cause. But our situation today is primary hyperhidrosis, so these associated symptoms will be negative. Then what can I advise in management about the patient part? What the patient can do to ease excessive sweating? You can advise her basically for us to help you with that, Amy. There are a few things you can do to ease your symptoms and a few things we can offer you today. Things you can do, then you will advise her to wear loose fitting clothes to minimize signs of sweating. She can wear black and white clothes as well to minimize signs of sweating. Advise her to wear socks that absorb the sweat and to change them usually twice a day, and as well to wear leather shoes and to try to use different ones every day or so. Advise her not to wear tight shoes and not to do things which triggers, of course, the sweating, as we mentioned about alcohol, eating spicy food or coffee or so and so. Easy peasy, clear cut information from NICE, so you do not confuse yourself. And then what things can I do as a doctor, or what things we can offer you? We can offer you strong anti-sweating agents, such as something called aluminum salt, which you can use it as a spray. You can get it over the counter. So first line, we offer aluminum salt antispirant, and that is given as a spray. You can advise how she can use that. You can apply that at night on the skin that sweats more, and please keep it overnight and wash it off in the morning. You can do that every 1 to 2 days until your symptoms get better, and we will follow you up in 6 weeks time. Please avoid shaving the area and using hair removal products within 12 hours of using the spray, and do not bath immediately before use. So easy peasy. Things you can do as a doctor is offering the aluminum salt sprays. She can use that at night and she can wash it off in the morning. Advise her to do that every 1 to 2 days until she feels better. We'll have a follow-up appointment in 6 weeks to review that, because if she does not get better in the follow-up, then you will need to refer to dermatology. And that is the second paragraph. If there is no improvement of the lifestyle changes and of the strong sprays, we can refer to dermatologist for other treatment options that can include tablets to reduce the sweating, maybe Botox injections as well to reduce the sweating, or even surgery can be offered at some point to remove the sweat gland. And as well, there is some electrical treatment that can be offered as well, and that is weak electric current passed through a bed or water. Just offer it as electrical therapy can be offered as well. That is everything you need to know from guidelines. If you look at the mind map now, it will make it easy for you. Let's do the mind map in a 12 out of 12 way. Hyperhidrosis, we think it is primary because that will be a young patient, maybe 18 or 19, having symptoms for more than 6 months or so with no apparent cause. Anyway, she is coming with a presenting complaint. Easy peasy. I will ask an open question. Can you please tell me more about that? Listen carefully to the presenting complaint story that is called the golden minute. After you listen to the golden minute, you still need to explore Udibara. Be efficient with Udibara. Ask her, when did you start experiencing excessive sweating? How long does it last? How often does it happen? Anything makes it better, anything makes it worse. At what age you started experiencing these symptoms? Does it happen at night? Does it wake you up from sleep? Do you sweat at sleep? Why Udibara is critical? Because as you have seen in nice CKS, Udibara was the characteristic features of primary hyperhidrosis. Yeah. So please take a decent amount of time in that step, maybe 1 minute or so, because that is the most critical step. Second step, as we do in every single mind map, is asking about trigger. You mentioned you started experiencing that for the last 6 months or so. Was there anything triggering that at all? Maybe stress is a trigger and anxiety is a trigger. As you know, some lifestyle habits can be aggravating or trigger, such as spicy food, coffee, alcohol, so and so. And then we finish presenting complaint by asking others. In that case, we have 3 others. The first other is an open question for the patient to help me. Mrs. Smith, with that, have you been experiencing any other symptoms at all? She may help you. Second other for me to ask is other symptoms of the same system. You know that from the general structure. So you ask, with that, do you have any other skin symptoms? Because sweating is a skin symptom. So ask the second other about skin symptoms. With that, do you have any other symptoms such as redness of the skin, itchiness of the skin, discharge of the skin? So ask about that. And then the third other, you ask about other locations. Do you sweat from any other places at all or not? Remember, in Udibara, when you ask about onset site, inside, you need to ask, is it symmetrical both sides or not? I hope it does make sense. So the first step, presenting complaint, Udibara efficiently, making sure to ask about timing. What time does it happen the most, and what makes it worse, what makes it better? And of course, you need to ask about sleep, and then trigger, and then the 3 others we ask, of course, is quite important. And then the second step is closed-ended questions to rule out differentials. To make it easy for you, what are the common differentials for hyperhidrosis? Basically, what are the secondary causes for hyperhidrosis? We need to rule them out because they will be negative in that case. Of course, hyperthyroidism, that is easy, okay? And then hypoglycemia or diabetes and hypoglycemia, okay? And then infection and the tumor, TB for example, and the lymphoma. The last one is pregnancy and menopause, okay, and anxiety as well. These are the 4 points I need to ask about. So the first one is infection such as TB and the lymphoma. You can ask about any spiking temperature with that, any unexpected weight loss, any lumps or bumps anywhere. Ask these questions and that will cover TB and the lymphoma. Ask about hyperthyroidism and anxiety. That will only need you to ask about bowel symptoms. So you can ask any change in the bowel habits, any heart racing at all. Asking about diabetes and hypoglycemia. That will mean you ask about urinary symptoms, basically any symptoms with your water works, and that will be usually enough. And then you can ask about last menstrual period. That will cover pregnancy and the menopause. She will be quite young, so no worry about menopause, but you can ask about when was the last menstrual period, any chance you may be pregnant. So again, closed-ended questions about 4 things. First one line about TB and lymphoma. Second one line about the bowel habits, and that will cover the thyroid problems. And then 1 line about urinary symptoms, that will cover the diabetes and hypoglycemia. And then ask about the period, which would cover menopause and the pregnancy. By that time, these things will be negative, which supports primary hyperhidrosis. Go to the third step in data gathering, which is general well-being of the patient, relevant maftosa. Why? Because that can give me a risk factor. Have you been diagnosed with any medical problems at all, such as similar, for example, in the past? Have you tried any medicines to help with that, or what did you try? Or are you taking any medicines on regular basis? Because some medicines can be a risk factor or can be a cause as a side effect. And then ask about family. Anyone in the family has been experiencing similar symptoms at all? Yes, doctor, my father had the same, or maybe my grandfather or my mother, and that is positive in 50% of the cases in real life. And then ask about lifestyle. How about your lifestyle? Do you smoke at all? Do you drink alcohol? Do you drink too much coffee? Do you eat a lot of spicy food? So specify some of the lifestyle, because they are possible triggers which you can use in your management to address. And then the last step in data gathering is psychosocial and ICE. Psychosocial, you need to ask how that has been affecting you. Has it stopped you from doing anything you used to do? Why? Because as you have seen in the guidelines, one of the characteristic features of hyperhidrosis that it stops the patient from doing his own activity. That was written clearly like that. So you ask her, has that affected you in some way, or has that stopped you from doing anything you used to do? And she can actually tell you, doctor, it's making me feel low or feel down. If she tells you I feel low or I feel down, you need to screen for depression. How to screen for depression? You can ask, would you say in the last month you have been losing interest in things you used to do? And the second question for depression, would you say in the last month you have been feeling low or depressed? If she says yes to one of these screening questions for depression, that is positive screening question. And then you can ask about self-harm, but that lady will not make it complicated that much. And then you ask about ICE. What do you think may be causing that? Anything in particular worrying you? Are you hoping for anything specific I can offer you today? In that situation, she can ask you, doctor, what is the cause of that? How long will it last for? Will I be like that forever? That will be her concern that you need to address in your management to get the 12 out of 12. That is the end of data gathering. You finish it by offering a relevant examination. What is a relevant examination here? Examining the area of interest or area of symptoms. So she's coming maybe with arm bits sweating, groin sweating. You will offer examining that part of the skin to check if there is irritation of the skin or infection or so on. So you can take vitals. You can check blood sugar. Why? Because hypoglycemia is one of my differential. You can offer BMI as well as a risk factor. Yeah. So I would like to examine you, Anna. That will include me checking your blood pressure or heart rate, your blood sugar as well, and will be checking your weight against your height. And if you don't mind, I will be looking at the area of the skin that you sweat more. As simple as that. And then give your diagnosis based on that information. Having listened to you and having examined you, I think what you are experiencing is what we call hyperhidrosis. Have you heard about that term before? No, doctor. So that is excessive sweating, which is common. 1 to 3 out of 100 would usually experience that at some point of their life. It can affect the whole body or just certain areas. Sometimes it gets better with age, but there are things you can do and the treatment we can offer to help with that. As simple as that, guys. Yeah. And then you can tell her what she can do and what you can do. Okay, so things you can do to ease your symptoms. Amy or Anna, please try to wear loose fitting clothes, maybe to minimize the signs of sweating as well. Try to wear maybe white and black clothes as well. That would minimize the signs of sweating. As we mentioned, guys, try to change your socks maybe twice a day, and wear absorbing socks as well. And leather shoes is advisable, and change them every day. And so if you can, try to avoid triggers which can irritate your skin or cause sweating more, such as spicy food, coffee, alcohol, or avoid tight shoes as well. So you will bring it from data gathering, and then you address in that step. Things we can offer you, we can start by arranging some basic investigations to look for any other possible causes for that, because we believe it is usually happens for no apparent cause, but we can look for possible causes which contribute to that. That will include us checking your blood for blood sugar. We'll check your blood for the hormones of the gland in your neck, and we can take a urine sample as well to check for other possible causes. Yeah. So basically for you guys, what we do, thyroid function test and blood sugar, of course, because these are causes. We do the full blood count, kidney and liver, and we check the urine for pheochromocytoma. You don't need to specify the medical jargons, just to be simple. We need to do a blood test and urine test to check for any other possible causes for that excessive sweating. And what we can offer today to help you, we can give you strong anti-sweating medicine that's called aluminum. You can get that over the counter, the spray, and then you advise her to use it at night. Keep it until the morning. Wash off in the morning. Avoid shaving the areas that you spray. And then if you do not get better, we'll follow you up in 6 weeks time. If you do not get better with what we tried today, we'll refer you to the dermatologist, to the skin specialist, who can recommend other options, such as giving you tablets or sometimes a Botox injection to reduce the sweating, or sometimes a surgery as well to ease the sweating, and sometimes some electrical therapy may be offered as well. Then you can offer a leaflet about the condition she can read about, and you can tell her that there is support groups available to help you with that. It can be quite overwhelming. You can sign both for the International Hyperhidrosis Society, which is a common non-profit organization, to help with that. You can read online about that one, or you can give a leaflet as well. As simple as that. Answer her questions. You need to get 12, and that is what you deserve. No magic, my team. Thank you. And if you are not in my package, you can easily join the full package of mind maps in similar like that. Just to contact me on that number if you'd like to join our package, which includes every single case that may come in your OSCE exam in a similar mind map like that, with the guidelines explained for you to get 12. You can contact me on that number for details. Thank you, my team.